Hi, I'm Shondria1311, and today I'm going to be talking about treatment approaches for addiction. After listening to this presentation, you'll understand what addiction is and what basis for any effective treatment options there are for the addict. I got a question. Has anyone known anyone who's been addicted to drugs?
Yes.
And do you think there's hope for the addict?
Yeah.
Well, my personal story is that I've been in recovery for 11 years and I now counsel other addicts. And so I'm going to be talking about the treatment options for addicts and even their families. The first question I want to answer is what is addiction? So addiction, according to the National Institute of Drug Abuse, is a chronic disease characterized by uncontrollable and compulsive drug-seeking behaviors, typically damaging the brain and causing behavior issues in that individual's life, affecting every area of it, their marital status even, their finances, their education, their employment, just every area of that individual's life is affected. And it also affects individuals of all ages, all races, all socioeconomic levels, and all religions. And according to the Substance Abuse and Mental Services Health Administration, 22.5 million individuals in the year 2014 was addicted to drugs. Less than 20% of those individuals entered any kind of program in that year, and even less than that entered any kind of program at all. So you see, there's definitely a need for treatment that's available for each of these individuals that are needing assistance. So the first setting that we're going to talk about is the inpatient setting. According to Harold DeWyko, which is the author of The Concepts of Chemical Dependency, there are two settings, inpatient and outpatient. So we're going to list some options for the inpatient. There's your therapeutic communities, there's your detoxification, and there's also transitional or residential facility. Typically, the inpatient setting is a 24-hour intensive care facility. And then we come to your outpatient treatment facilities. According to Gerald Corey, who is the author of Theory and Practice of Counseling and Psychotherapy, there are cognitive behavioral, family counseling, support groups, and then according to Williams Rolnick and Stephen Miller, which are both psychologists who authored Motivational Interviewing, which is another type of counseling that they use, which is client-centered. That's also a real popular one that's used in the outpatient facility. Now, because of the various and wide array of problems that drug causes individuals, there's several services that need to be addressed in the individual's life. So each of these facilities assist with several services and several methods. And so some of those services are your vocational services, your mental health services, legal services, you have educational services. They're all addressed in these facilities. And of course, there are several methods that are used to obtain the necessary information so that each plan for each individual can be individualized. So you have your assessment, you have your supported programs, you have constant monitoring, and you also have evidence-based treatment used in each of these facilities to help the addict. And so the question I asked in the beginning, is there hope for the addict? Well, this lets us know that there is hope for the addict. There are several options, not only for that individual, but also for their family. And the more you know, the better it is that individual can make an informed decision about what option is best for him. Are there any questions?
Can you tell me more about the residential treatment?
Sure. Well, in the residential treatment, it's usually set up in phases. Say the first 30 to 60 days, it may be intensive, where they go to groups from morning to night. After that, they slide into a less intensive phase where they may go to a few groups, but then they'll start addressing those outside issues like I was talking about, your medical services, your educational services. And then finally they transition to where they actually are going out looking for jobs. They're still going to support groups and still seeing a counselor on an individual basis, but they're looking for work, ready to transition into society. Any other questions?
What about the outpatient services?
Okay, for the outpatient, typically that's for the individual that may have a full-time job, is the breadwinner of their family, and they can't be in a facility 24 hours a day.
Yeah.
And so they go to the outpatient facility. They may have 2 or 3 groups a week, depending on the severity of their addiction. They see their counselors, they go to support groups, they receive an individualized treatment plan, but they too go to weekly groups, weekly meetings to help the individual. Thank you.
Is it?